Hello everyone, welcome back to our YouTube channel. We are glad that you've tuned in. So today we're going to talk about some of the questions that arose from our last session, and there are two major questions that are quite a bit. And one of the questions is, what are some of the causes for early pregnancy loss, and what are the danger signs in pregnancy? Then finally we look at how do you get these antenatal services from Primacy Aid Care Limited, which is a virtual healthcare facility. Karibuni sana, ride along with us. So, some of the causes of early pregnancy loss would include things like, if you've ever had a pregnancy loss, then it goes that in your second pregnancy and subsequent pregnancies, the risk of developing or of losing that pregnancy becomes also very, very high. The other thing that you might want to look at is advanced age. For women who are about 35 years and above, the risk of losing your first pregnancy or early pregnancy is very, very high. And so these are spontaneous abortion. And when you talk about spontaneous abortion or miscarriage, we mean things like, missed abortion, threatened abortion, incomplete or complete abortion, and inevitable abortion. The other thing that may cause early pregnancy loss is an extrauterine pregnancy. That means a pregnancy that is growing outside the uterus, like in the fallopian tube. So because of the nature and size of the fallopian tube, it is not able to carry a pregnancy up to term. So it means somewhere by the time you're getting to 3 months, then the pregnancy is likely to be lost. Then we have got diabetes. Sometimes in pregnancy you're not aware whether you have diabetes or not. So if it is not well controlled, and the diabetes that is insulin dependent, it could lead to early pregnancy loss as well. Thing is hypertension as well. So it's very good to attend your antenatal clinics where you have your blood sugars checked and blood pressure checked. So undiagnosed hypertension can actually lead to pregnancy loss. Then we have got other infections such as bacterial infections, viral and fungal infections, and this includes HIV as well. So early stage HIV can actually lead to miscarriages during pregnancy. Then we have got things like trauma. So trauma would include maybe you got an accident or you fell or someone hit you. That can cause pregnancy loss. Alcohol use, smoking, use of other hard drugs can actually lead to pregnancy loss as well. Then the other one is uterine adhesions. By uterine adhesions, we mean conditions such as endometriosis and fibroids, depending on the location and size of the fibroids. And then we have got things like placental abnormalities, but these ones usually occur in late pregnancy. So that is placenta previa and placenta abruption. Then we have cervical incompetence, where the cervical os is weak. So it means you can get pregnant. By the time you're getting to the end, towards the end of the first trimester, the os that actually is supposed to keep the pregnancy in automatically just opens, and the pregnancy is lost. Once the os is open, then there's no way the pregnancy can be maintained. So those are some of the reasons why a pregnancy can occur a pregnancy loss can occur in your first trimester. So the other question was, what can you look out for during pregnancy that signals danger or pregnancy loss? So when you're pregnant, it is not normal to have vaginal bleeding. So every time you have any sign of spotting or vaginal bleeding, kindly just have it checked, because that could be a precursor to pregnancy loss. Severe abdominal pains as well, those are things you want to have checked the moment you start experiencing them. Elevated blood pressure. By elevated blood pressure for pregnant women, you want to make sure your blood pressure is between less than 140 and 90, and not less than 90/60 while you're pregnant. So excessive swelling on the face, upper limbs and lower limbs. So these are things that are usually normal, but towards the end of the second and third trimester there. But when you start having this in early pregnancy, kindly just have it checked so that you're ruling out things like eclampsia and preeclampsia. Severe headaches or migraines are very, very important to have it checked. Blurry vision could be a sign of diabetes or any other serious condition in pregnancy. High fevers and excessive nausea and vomiting. So nausea is, you can have nausea, a few times in the course of the day, but when the vomiting exceeds more than 3 times in pregnancy, that is something you want to have it checked and monitored, because then it can lead to dehydration and can cause some other severe problems in pregnancy. We are availing our contacts. We have contacts. You can call us, you can WhatsApp us. Again, you can reach us through our website. You can reach us through a mobile application. So we'll have a doctor or a nurse or any other healthcare provider that is needed to take care of you at home come to your home, and we'll get the entire comprehensive antenatal package right at the comfort of your home. Thank you very much for listening to us today. Please subscribe and follow us on all social media platforms. Our YouTube channel is Primacy Aid Healthcare Limited. Follow us on TikTok, Twitter, and Instagram as well for more information about your health. Thank you.